So this is an invited session of the AAEA meetings held at a time after the formal meeting ends at the request of the AAEA. I am the organizer, Jeffrey Dorfman from the University of Georgia. We will have papers today by myself and my two co-authors, Jared Grant and Julian Worley. We will present third. Craig Gundersen of Baylor now, and Elaine Waxman of Brookings, right, will
Urban Institute.
Sorry, Urban Institute will present second, and Becca Jablonski from Colorado State will present first. The subject of this session is food assistance in the time of COVID. And so without further ado, Becca, I will let you have the floor.
Okay, hi everybody. This is some very preliminary work, and so we really welcome feedback, especially this is a fantastic group to get feedback from. So this is from some work I've been doing that is funded through the Foundation for Food and Ag Research with colleagues Rebecca Cleary, Aaron Love, Alessandra Bonanno, Noreen Mena, and Laura Bellows. Laura left us, unfortunately, to go to Cornell. The rest of us are with Colorado State University. And so as Craig knows, because he's been part of this effort as well in a slightly different way, our team was initially funded by the Foundation for Food and Ag Research, and I'm the PI on that grant. And when the pandemic hit, they offered us actually additional funds to do a little bit of a pivot and extension of that work to try to look a little bit more at COVID and some changes in household acquisitions and purchases. And so anyway, this is some preliminary results of that additional work. So this is something that everybody on this call is very familiar with. The schools closed essentially overnight, and the school districts had to figure out how they were going to respond in conjunction working with municipalities. And we know how important the National School Lunch Program is, and so thinking about this response is really important. With the school closures, the things that I wanted to highlight here are that there was this additional flexibility in programming and reimbursement, but no federal mandate that there be continuation of school meals or school food service. And essentially it led to this patchwork of emergency feeding programs. And actually the FAR teams that were funded at the same time that my project was, there were 5 of us as part of the Tipping Points program. We published an article on this in a special issue of APP last year. And it was really interesting to get insight into, the different ways that 5 cities responded, because we really can see some examples of, I think, what went well and what didn't go so well, and what were the sort of precursors that needed to be in place to have sort of a better response. And so we tried to document some of that. But anyway, so the concern here is that with the change to summer feeding programs used by schools during COVID, that those summer feeding programs notoriously don't reach the same level of kids that the schools are able to reach during the school year. And also that there's a reduction in the nutrition standards, or really there's very small amount of nutrition standards that are in place with these summer feeding programs that actually haven't been updated since 2000. So there's a concern both in, are we feeding the same number of kids or the same number of households once the school is closed? And 2, do we actually see changes in nutritional standards and thus dietary quality of what the kids are being fed? And this is some data that came out of the ERS. And you can see this is from March 3rd to 15th, 2021. And it's really a very small percentage of households that are getting food from schools and other programs aimed at children during that point in the pandemic. And the last piece of information I wanted to provide as sort of a precursor here is that through working closely with partners in Denver, one of the things that they pointed out to us was that at the time in the pandemic, so this is from July, but the same thing was true a little bit earlier, is that at the same time where they saw that there was an increased need for these different types of emergency support services, that there were also historic closures of food pantries. And so they documented that only 62 of the 106 food pantries were in operation prior to the pandemic. Now, this being said, and I've had some conversations with Craig about this, you know, that the food banks were actually able to move a lot more food during this period, despite the closures. So I think the concern here is not if they weren't able to move as much food, but are there potentially particular subpopulations that were left out because of these closures? So the research questions from this larger project, you know, the first is in which national, state, local, or community food assistance programs did households, and especially households with kids, participate in during the pandemic. And that's, I'm going to talk a little bit about that today with some of the preliminary data we have. And the second question is there a relationship between dietary quality and the program levels in which households with kids participated? And here we've been really fortunate. Our colleague, or our former colleague, Laura Bellows, is now at Cornell, basically was able to publish a tool and get it validated that replicates the food apps data collection protocol, but to do it online. And so we were able to use this validated instrument as part of our survey. However, we have not started to clean and analyze that data yet, so I'm not going to be presenting on any of those results, but we're really excited to see what that shakes out. So the survey we did, all materials were both in English and Spanish, as well as all promotion was in English and Spanish. I'm showing you an example of a flyer on the right here in English. This was distributed by partners in the city and county of Denver. And I just want to be really clear here, we did not have a goal of getting a representative sample of households in Denver. We really wanted to focus on getting low-income households that might be utilizing some of these programs, and especially households with kids. So that was really how we asked our partners to target. So we worked closely with the Denver Department of Health and Human Services. These groups are very, very well networked, and which is one of the reasons that we think they were able to respond maybe better than some of the other cities in that APP article that I mentioned. So they have a food team partner email list that includes a listserv of 1,200 people. Those are the partners, and then they all disseminated it. We also have this program called Healthy Food Denver Kids, which I'll tell you a little bit more about in a second. And that program gives out funds about $11 million a year. And so they have an incredible network. And then there's also a SNAP team that also has a good network. And then we also have some nonprofit partners. There's an organization called the Colorado Blueprint to End Hunger that essentially networks together all of the nonprofits that are working in this space across the state. So anyway, really, really great coverage, I think, through these partners. The eligibility criteria was that you had to live in the city and county of Denver. But as I said, we really targeted this towards low-income households, but that wasn't an inclusion or exclusion criteria. And then we did offer a $20 incentive. We offered a gift card to their choice of King Soopers, Safeway, or Walmart. So this survey had a number of parts. It was pretty lengthy. Qualtrics estimated that it would take about 45 minutes to complete. So we asked questions about sort of just basic respondent information, who has responsibility for purchasing, but race, ethnicity questions, educational levels. We asked a series of questions about the adults and the children in the household, and then we're able to follow to really look at some of the specifics of each of those individuals. Neighborhood and food shopping characteristics. Like the percent of household food purchased by the type of store, food acquisitions. We used the ERS food security questions, asked questions around changes in employment due to COVID, or changes in income due to COVID. And then we used this home idea survey protocol that I mentioned earlier that Laura Bellows has put together, which is the food apps of replication online. So I've never, ever had this happen before in a survey, although I usually do survey work with producers. So we put out our survey March 1st, and within 24 hours, we had over 1,000 responses, which was just incredible. And I think probably points to, one, just the network we had sending this out, but I think also the fact that a $20 incentive was pretty significant for households that were pretty hard hit at this moment in time. So you can see here the breakdown of initial responses. We closed the survey after 10 days just because we were paying $20 incentives. And initially this was really supposed to be a pilot survey. We were not expecting more than probably 200 responses. So we closed that. We dropped respondents that didn't live in Denver. And then we also dropped respondents that took less than 12 minutes to complete the survey. And I actually reached out to Craig about this and would be really interested to hear if others have thoughts on the best way to clean these data. We ended up following the recommendation of Qualtrics. So basically Qualtrics estimated that the survey would take about 48 minutes. And so what we did was we dropped all respondents that took a quarter of that time or less. Craig, and if I'm misquoting you here, you could just step in. But I think Craig's comment was that usually what he does is does this type of cleaning on a per question basis rather than at the survey level. But we've been trying to do both. But again, if others have thoughts, we'd love to hear. We've also then, of course, been doing checks for like flatlining, you know, if people put all yeses or nos and some things like that. But I do want to give the caveat here that we are not 100% finished cleaning the data. Cleaning the data it's a much more complicated process than we had anticipated. But given the sample size of 702, these are our breakdown of some of the descriptive statistics. So keep in mind that we do not expect that our population is going to be representative of the Denver population because that was not the intent. That being said, we do have similar population in terms of Hispanic, but our race breakdown is very different. So much higher, like American Indian or Alaska Native, as an example. And actually, I'm sorry, this is a typo, and this shouldn't just say American Indian or Alaska Native. We do have higher population there, but we actually grouped all of the others together there. And then you can see the educational attainment level. So what I thought I would do now is just show you some of the ways that we're starting to break down the data. And again, this is still new, so I don't have any final conclusions here, but really welcome your thoughts. So one of the challenges we're still having with the data are that you can see here we've broken down responses for percentage of households that received food and or money from a national or state program or policy by households where there's a child present versus households where there's no child present. Well, we know that some of these programs are targeted towards children, yet we're seeing that there are no children present. So for example, if you look at like after school program, the backpack program, Head Start, right? WIC, although I guess you could be pregnant. But so there may still be some challenges here of things we want to clean out. But I do think we're seeing some interesting differences in terms of acquisitions or programs that these households with and without kids are participating in. I think maybe one of the more interesting things is that Meals on Wheels is the only program where we see that there's higher levels of participation for households that don't have children present. And maybe that's because they're really targeted more towards seniors. This is the same information, but here, and we just did this so you didn't have a zillion of these bars on one slide. We're looking at specifically for local or community assistance programs. And so here what we're seeing is that it's the community centers and the food banks and food pantries are the only local or community assistance programs where we see higher levels of participation for where there's no child present. Here we're looking at the percentage of households, again, that received food or money from national or state programs or policies, but we're breaking it down by race and ethnicity. Again, that other category we lumped together because we have small numbers across anything that's not Black or white. And I think, so I should say, so for example, I think that other category included a total of 78 households. So here what we see is that I think the only program where we're seeing that there is a higher level of participation by white households is this Healthy Food for Denver Kids program. So this is, I was mentioning it briefly earlier, this was actually established through a ballot measure. It provides, I guess it provided $7 million to 64 organizations in 2020, but it's projected to provide about $11 million a year. And it's interesting to me that this has higher participation by white households, and it's the only one because they are specifically trying to target, I think, underserved and more diverse populations. So anyway, that was an interesting that we wanted to look into. And I think once we present this to the stakeholder groups we work with, that'll be something that jumps out at them as well. So this is the same information in terms of breakdown between Black and white, but we're looking at here the local or community assistance. Here we're seeing that the community centers are the only place where we see higher levels of participation by white households. Here we do the same thing, but we're breaking out by Hispanic and non-Hispanic or Latina populations. And we can see that Hispanic and Latina households are less likely to participate in all of the national or state programs or policies. Now, this is not my area of literature that I'm familiar with. And so I'm just curious if this is something that others have seen throughout the literature, if this is a common finding, or if we think this is something that's more specific to the population that we targeted. And we see that this is also true if we look at the local and community assistance programs. So this is transitioning now to actually look at for households that are participating in SNAP or not participating in SNAP, and where they're actually purchasing products and purchasing food. Now, keep in mind that this is the raw data, and we did not constrain the households. So they're using a slider bar in the Qualtrics survey here, and we didn't constrain them to making it so that all of their purchases had to equal 100%. So what we're looking at here really, I think, is much more of a reflection of where households feel they spend money, but not actually where the money is spent. You can see it, right? It doesn't equal 100%. And so what we're going to need to do now is go back and normalize this. But I still think it's interesting to just look at this way. And so we can see that supermarkets are the only place where households that are participating in SNAP other than other are spending a greater proportion of their budget, that household food budget. And then we looked at the same breakdown in terms of where people are purchasing food, but here we're looking at it by race. And you can see white households are more likely to shop at every location except other. And then this is the last slide that I wanted to show you, which is the same information, but broken out by Hispanic or Latino and non-Hispanic households here. And we see, that there are not as many differences, and we haven't done any, t-tests on any of this yet. You can see that there are probably some slight differences there in supermarket, as well as wholesale and discount or big box stores, where we see that Hispanic or Latino households are more likely to purchase or spend money in those locations. So in summary today, this is a pilot survey, so I really do want to emphasize that it was not designed to be representative, right? We were fairly focused on getting poor households and households that were more food insecure to see where they were acquiring and purchasing food and which programs they were participating in during COVID, particularly given school closures, and then also trying to look at the relationship with dietary quality. So, we're still, we're still, unclear on some of these components. We see that different programs reach very different shares of the population, right? When we break it down by kids, households that have kids versus no kids, race and ethnicity. But for a lot of these, we're still really investigating why. And I think there's a bunch of interesting papers that are going to come out of this. So stay tuned.
All right, thank you, Becca. I think what we're going to try and do is we can handle a few brief questions after each presenter. And then after all three papers, Norbert will do his discussion, and then we can have more general, longer comments, questions, free-flowing discussion. So I'll just start, Becca. I think on your data cleaning, I think taking a 48-minute survey and saying if you did it in under 12 minutes, you weren't taking it very seriously is probably reasonable. What I would just encourage you to do is to essentially clean your data into 2 or 3 data sets. So your preferred clean data, and then one that includes sort of the questionable ones, like they completed the whole thing, but in 10 minutes. And just when you're running regressions, run it with the smaller, cleaner sample and then the slightly dirty sample. And if you get basically the same results, then that shuts up all the people who complain about how you cleaned it.
Excellent. That's an excellent idea. I'm just taking notes.
So, so Becca, I'm glad to see this work being displayed. There's just two things that seemed a little bit, something maybe going on with it is, first of all, I mean, SNAP participation was lower than WIC participation. And I mean, I know WIC has a higher threshold, but most all the sample won't be eligible for WIC. And we know that after infancy, WIC participation rates are very low, in fact, substantially below SNAP. So that was a little bit surprising that if the WIC was higher. So I wonder if people may be thinking, I got WIC a long time ago. I don't know how people are responding. The other thing was about supermarkets is that we know like 80% of all SNAP dollars are spent at large scale supermarkets. You know, a third of all SNAP dollars are spent at Walmart. So I was a little bit surprised that, that you found it was the most common, but there was always other ones that seemed a little bit. So I was surprised about that. The only thing I can think of is that maybe people thought Walmart was other because they're selling other stuff there in addition to food. I don't know what the reason might be, but I was a little bit surprised by that. So just two comments about that.
No, thank you, Craig, for that. You know, one concern from this population is that they don't actually know what the SNAP is, right? That we maybe used the wrong term because we've certainly now been hearing that from some of our partners. I wish they'd brought this up ahead of time. But that I think is a concern. We do see that there's higher, I didn't present any of this, but there is higher participation rates in PEBT than we see in SNAP. But I guess that would be expected. So yeah, we definitely need to dig through the SNAP WIC piece more.
Okay, any other quick questions or comments for Becca?
Hi, Becca. I think it's very interesting study. So one thing you may think of is about the language barrier and how does that explain some of your results between, you know, you find Hispanic population use less charitable food assistance, and could language play a role in that?
Do you mean, so we did put the survey was administered in both Spanish and English. You're talking about the program itself not being available or in other languages to promote participation.
Yeah, or people who are, you know, maybe those filling out the Spanish versions are, you know, have more language barriers so that they cannot use the food assistance program or, you know, or charitable food assistance program as often as they want. So, and you have that, you know, you have a Spanish version and English version. So maybe you could have that as a variable to explain some of your findings.
Great, thank you.
I just wanted to just ask or say real quick, I liked how you had the distinction between households with children and without children. Do you think it'd be interesting to see like how with the supermarkets, like how you show the non-Hispanic and Hispanic? So you see where like, okay, shop at a supermarket from that has children, not children. Because I really liked how in the beginning where you showcased like if there's households with no children that get the bag or get children programs. So
I had thought about your like households with and without children. There could be like where those like numbers were weird, where some of them were like specifically targeted to children and there were households that didn't have them there. Of like if there's maybe I don't know if there's like enough of this to make a difference, but like if you've got children who are in divorced families and like maybe they don't live, you know, full-time with one parent and like but they're still counting, so they're like, I'm a household without children but I have kids, or like they're living with a grandparent or something, you know, non-typical households that might be causing some noisiness.
Thank you. You know, I was also thinking that, you know, given the waivers that were in place, you know, maybe it's that a neighbor was picking up food, for example, from schools and bringing it back. I mean, you just, right, there could have been different types of arrangements. The other thing is, I don't think that this was as true in Denver, but at least in some of the adjacent counties, we had with the school closures, it was actually like the food banks that were providing the school meals. And so there's also some really blurry lines, I think, and you know, it could have been that the school communicated about the location, but it was actually the food bank that was providing it. So anyway, there's just a lot of messiness that we're going to have to try to sort out here, which is why we don't have a full paper yet.
Okay, great. All right, good questions and comments. All right, Craig, you are up.
Okay. Let's see. Okay, so I wanted to begin by thank you, Jeff, for inviting me to be a part of it. I really appreciate it. And I always thank audience members, but I especially want, this time I actually get to explicitly say who is here that's not part of the panel. So Lynn, Park, and Will, I really do appreciate all three of you being here today. It's very kind of you, it really means a lot. I also have to begin with an apology, is that this report hasn't been released, and therefore there were some problems about whether or not, sometimes places are more strict. If it was my work, I'm like, I don't care, you can look at it even as my release, but Urban's a little bit more strict about these things. So I have to apologize to Norbert that I didn't have a paper to him. All I had was the slides. So I apologize for that. I was a discussant on a panel 2 days ago, and for 2 of the 3 papers, I just had slides, so I know how difficult that can be to talk off of. So I apologize and look forward to your comments. Okay, so along with the co-author that Jeff mentioned is Teresa Anderson, also of Urban Institute, is a third co-author on this. Okay, so the title of this is, as you can see there, was supposed to concentrate on emergency meals to you. As I'll explain to you momentarily, is in reality is this look at 2 different programs during COVID, Summer Meals to You and Emergency Meals to You, because we weren't really able to separate out the impact of the 2 different programs. So I'll explain that more later. So this is COVID focused, but it's not focused necessarily on Emergency Meals to You per se. So when we think about just in a non-COVID time, because this is when the program emerged, is when we think about food insecurity among children, is that during the school year, you have SNAP, you have the National School Lunch Program, School Breakfast Program, and charitable food assistance, which is both directed towards children and towards full families. Okay, so this is what we have during the school year. Now, once all these things are not available during the school year, once children go home for summer, is that there was some early work by Mark Nord, and I think it was Linda Cantor, but no, Ramig, I forget who it was. But at any rate, Mark and somebody else used a variation in the timing of the core food security module to show that sharp increases in food insecurity in the summer, and you talk to food banks, you hear some similar things. And this is primarily because that during the summer, all you have then is SNAP, charitable food assistance, and the summer food service program. Okay, there's the summer food service program. And for various reasons it's not particularly, well, it can be effective, but maybe it's not as effective as some other hypothetical summer program we could imagine. And then it's somewhat limited insofar as it's a limited number of sites. Okay, this is not akin to like SNAP or what's an entitlement program or National School Lunch Program or School Breakfast Program where coverage is almost universal. It's definitely not the case with the Summer Food Service Program. And even in areas where there are these summer food service programs, participation rates are relatively low. And they just have some, what I perceive as really archaic rules about getting food. So for example, if my child goes to a summer food service program and they get an apple there, is that they have to eat the apple at the site. Even if they're just coming there for lunch and that's it, they have to eat the apple there at the site. Otherwise, they have to throw it away in the trash can in front of everybody. Okay, or same thing with milk and other things. So it's kind of a weird program insofar as massive. I don't care about food waste, but I do care about the fact that these kids could have eaten the food at home rather than having to throw it away. It just seems silly and punishing. Okay, so in response to this issue regarding this lack of food assistance over the summer, this Meals to You program was established first in 2019. Okay, and this program was directed towards those who receive free or reduced price meals during the school year. Okay? So actually more specifically, it's directed towards children in participating schools that received free or reduced price meals during the school year, or for schools that have community eligibility provisions, is to all children in that school. Okay? And what this Meals to You sent is that they're shelf-stable items that are meant to cover in the emergency program, which began in March of 2020, okay, due to COVID, is that every 2 weeks is meals for breakfast and lunch were sent. And then under the summer program, both in 2019, 2020, and 21, we're beginning again this summer, is there's 1 week plus an extra snack. Okay, so this was the structure, is these boxes of food were sent to families and then they would pick it or get it at their doorstep. As I said, is that, sorry, it's actually April 2020 that it began. This is the 4 rounds, is we did a separate evaluation for this round. What I'm going to be covering today are these 2 rounds, and then we'll have to evaluate the 2021 summer one. Okay, this is a USDA funded program, and it's run by Baylor Collaborative on Hunger and Poverty, which is where I'm going to. 75% of my appointment is with BCHIP. My tenure home is in economics. I should note is that I was doing the analysis before I went to BCHIP, and I was working as a consultant for Urban, so now I'll probably become an unpaid analyst. But anyway, however that ends up working out, but at any rate, I was involved on the Urban side of evaluating this rather than the Baylor side. Okay, so in 2020, this was a national program insofar as 42 states participated in the program. But it's a little misleading insofar as some states would just have like 1 school district and only a few participants. It was really kind of a patchwork of different communities. Most recipients are in Texas and Louisiana. So if I was to characterize this, I'd probably say this is an evaluation of a program that was in Texas and Louisiana. In terms of Texas, is that 2019 was almost all the places were in this time period. Now, before turning to this, let me make a few more comments about the program. First is in 2020 is we had sites at a lot of Alaskan Native communities, in Alaska, and then we had several sites on American Indian reservations. So they are part of this analysis, but I think for various reasons is they can almost be analyzed separately. We actually are doing quite a bit of work to analyze those groups separately because it's a different structure and a few other different things about it. The second comment I would make is that the whole goal behind this program is to try to reach areas whereby summer food service program may not have much coverage. These are rural areas, might be hard to get kids to those areas. And it could also be the case that, is that these are oftentimes rural areas with relatively less access to food stores. As we can talk about later, it's actually an obverse relationship. Those with the longer distance to travel to food stores actually do better than those with a shorter distance, but we can talk about that later. But the general idea behind this is sending these things to groups, to areas of the country where summer food service program isn't much of an option, and another food may be also more predictable to obtain. So this is the goal behind this program. Okay, so what is the data collection? Is that there's 103,000 households that received, I'm not going to break them out. So what I'm talking about, I'm going to stop talking about that these were separate programs. I'm just going to say we evaluated them together. So 104,000 households in this. And then we took a sample from of these households at one point in time in May, June, and then at another point of time in August and in September. Yep. So these were the 2 time frames that we analyzed this at, and I'll show the analysis. It's separate. It doesn't really matter which time period we look at, but so the survey and questions included the food security status over the past 30 days, and we use a 6-item scale. I just want to put a plug in. I'm going to talk about this a little bit later about what this is, but the 6-item scale is often used because it closely mimics the 18-item scale. Okay? there was a lot of work done by Mark Nord and others to make sure that this was the case. The problem comes in, especially when you're looking at children, is that there's a high proportion of children, households with children, that in some sense answer a lot of questions affirmatively beyond the 6 items. Okay? So the 6 items, even though it works well on average for portraying food insecurity in the United States, once you get into looking at children, especially vulnerable children, it doesn't do quite as well. And I want to turn to that a little bit later. Standard set of demographics that are asked, standard set of income, and then, even though I'm not analyzing this today, is that to look at we'll ask, this is a repeated cross section, not a panel filtration. Yes, it's 2 separate cross sections. Yeah. So, and then looking at program experience, whether or not they liked it. It's actually fascinating because I have these weekly phone calls with Baylor about this and the rest of the urban team. Just some of the challenges that are faced with shipping food. It was pretty interesting, some of the things that you would learn. Okay, so what's our analytical strategy? So at the outset of this is we consider looking at a standard RCT with a control group. I talked about this back in 2019 when we first looked at this, is that we wanted to do a standard RCT with a control group. I find these sorts of things to be really ethically, I find a lot of the RCT work that's being done to be really ethically questionable. Like I was just talking to somebody today about these programs that want to analyze, SNAP restrictions or things like this. I'm like, well, it's kind of unfair to poor people to be like, we're gonna run an experiment on you. I find it ethically suspect, especially in the context of something like this. We're going to say to people, we're going to give you these benefits. This other group is not going to get them. I just have ethical problems with that. But it's also not feasible. Even if somebody had said, we don't care about ethics, let's just do it, is that it wasn't feasible given the timing. We got notice that this program was going to go into place, and about 2 weeks later it was in place. We had no time to do a baseline thing. So another thing we thought about, which I think is ethically less suspect. Also, I hate with these RCTs where somebody's like, we will give you the benefits in the future. Whenever that's said, I'm always like, well, if you're going to give them the benefits in the future, that means you think the program works. So why are we doing this whole analysis? It doesn't make any sense whenever people say that either. But at any rate, is one thing we also considered was to have an RCT that was comprised of a wait list due to the limited size of the program. So we're going to look at people who are on the wait list who couldn't be served because of the size of the program. But it was good news. It ended up with bad news for our analysis, but good news for the persons was that it ended up being enough money. There was more money put in so that there was no wait list. Okay, so what we did is our only source of variation then that we had was we had variation in the number of meals received prior to each survey. Okay, so some people received, in essence, 4 boxes worth of stuff before the survey. Others received 1 box of things before the survey was taken. So this is the source of variation that we used in our analysis. So it's not a treatment versus control, whereas instead it can be seen as like a dose response with respect to this. I mean, there's no selection issues in this context that I can see insofar as how we're doing this, insofar as it's random how many boxes you got based upon where your school district is. I'm less concerned with selection issues. We use 2 measures. One of the measures is a binary, the standard food insecure versus food secure. The other is a continuous measure with 0 to 6 affirmative responses. We controlled for the standard set of covariates. So here's what we found. I was actually shocked. I didn't think this program would have much of an impact, but we found that it did. This should be percentage points, is that, for those that each additional 10 additional meals led to, almost a 1 percentage point decline in food insecurity amongst those who are doing the survey in the early summer, and similarly for those doing in the late summer, and this was statistically significant. So it was a larger impact than I probably would have anticipated. I'm going to turn a little bit to this at the end. Okay, Same story here is if you look at the score is for those in the early summer, it's a statistically significant lower number of affirmative responses, statistically insignificant for late summer, but of similar magnitude. And then even though I'm not really looking at things about emergency to you versus school meals to you, is that in the early summer, the emergency meals to you had a bigger impact than the summer meals to you. Well, it had a smaller impact, but statistically significant. And same story here with the late summer. Okay. So across the board then and here's areas that are more rural, is that, you had a higher number that were, you had a bigger impact, which is consistent with the goals of the program. It was designed to help out the rural areas more, and we saw a bigger impact there, which is good news that the program showed a bigger impact there. Okay, so now I want to turn to the conclusions, but before turning to the conclusions, I do want to make one remark. I try to put these results into context, and I really don't know the best way to do this if somebody else has something to say. So Brent Kreider, John Pepper, and I wrote a paper for a special issue of Journal of Econometrics in honor of Chuck Mansky, where we looked at the impact of National School Lunch Program. There we just look at whether you're on or off the program, but insofar as if you can break down the number of meals received, is that and then count that as the impact of getting the National School Lunch Program. It's a very, very rough comparison, and that you find similar impacts to this program as you do for National School Lunch Program. Again, there's so many caveats, as you all know, between making those comparisons, but it was roughly similar to the National School Lunch Program. Okay, so now I want to turn to my conclusions. Again, this actually was an effective program. I was pleased that it showed a reduction. I wasn't sure if it would. But I want to say that the impacts might be understated. And I want to come back to this point I made at the outset, is that in our continuous measure, we were only measuring if somebody moved like from 6 to 5 or 3 to 2, okay? However, you may have a lot of people who, if you had the full 18 item scale, let's just suppose you had the full 18 item scale, and they may have been responding affirmatively to, 14 questions. And then after the program was implemented, they were responding affirmatively to 12 questions. But that would have been censored at 6 affirmative responses in both cases. So the impact may have been understated because of the censoring that occurs on this. Okay, we have a couple further questions that could be answered. Is that there's a comparison with programs like pandemic EBT. Okay, pandemic EBT was put into place, last summer, and it's in place again this summer as a. I'm sorry, this is a program that gave benefits to school-age children over the summertime, even if they did not qualify for SNAP. Those getting free reduced price lunches would get these, which was like a SNAP, and you get the card and everything to do this. And so I'd like to see, what has a bigger impact, these boxes or that? I don't know the answer to that, which comes to the next question is what type of households prefer boxes over some summer food service program or summer ABT program? Now, I can imagine that in a lot of cases, it'd be like, look, just give me the pandemic EBT card and let me use my own discretion at what I want to purchase. Okay. For a lot of people, I think they would say that. Okay. Especially in areas with relatively good access to food stores. Okay. And another case is that with the summer food service program, maybe some parents are like, look, this is a great program. My kid goes there, he's there all day. Or, and she's there, 4 days a week. It's great. I'd rather have them eat at this place rather than having me give them the food because they're at home. So I think it's a good thing. On the other hand, some families may just prefer the boxes. They get shipped to their door. They don't have to go on and worry about all this. Maybe they get excited. Hey, what are we going to get this time? What are we going to get this time? Something might be exciting about getting this. And so there's this. So I really don't know, but I think that in a program like this is giving families more options about what they want to do over the summertime is useful. So, okay, thank you.
All right, again, we have time for any immediate questions for Craig. I see Park typed one in the box.
Yeah. Wait. And a question. Oh yeah, okay. What is the cost effect? All choices. And a question. What is the cost effect? Yeah, you mean, so Park, are you framing, if I could ask some clarifying question, are you framing this in the fact that it may be the people are getting, I don't know, the value of the meals is $40, but it costs the government $15 to send it to them? Is that what you're talking about? Okay. So that's the comparison I would like to make, is to say, okay, you get a box with $40 worth of food, but you don't have choice over what the food is. Would you rather prefer that? Or would you rather prefer to get $25 worth of food of EBT and then make your own choices? I think, yeah, that's the way I should have framed it, Park. Thank you. That's another advantage to getting a box over this, is you could get more food than you otherwise would.
Another question, Craig, just so we understand the magnitudes, you showed 10 additional meals effect sizes. That's 10 additional meals in a month, and it's food insecurity over the previous 30 days?
Right. Well, I guess, okay. So for the early summer one is that it should be seen as, okay. For the early summer one, that's the way it would be interpreted. 10 additional meals, because the timing was such that people were getting over like 30 to 40 days. So that's exactly how it should be interpreted. For the late summer one, it's 10 meals received, 10 additional meals received at any point over the summer, not necessarily just in the past 30 days.
But food insecurity still lasts only about the 30 days.
Yeah, exactly. And part of the reason we framed it this way is unlike, I don't know, National School Lunch Program, where there's no, once you get the food, you're done with it, is that with this is, shelf-stable food. So it could have done that.
And then just one more quick question would be, it'd be super interesting to break down which questions, on the scale were the affected ones, because I could easily imagine different responses to different things. It'd be very interesting to look within them. Right.
No, I agree. I think that's an underutilized thing is, don't tell Mark Nord this, as Park knows, that we're going to actually break up the individual questions since they always talk about it as a scale. But, but I think that could be useful.
Craig, just a clarifying question about the selection issue. How are the meals, like how does the program, like how do they choose which school district to distribute those meals, and how do the parents or the students choose to receive those meals?
So there was almost no choice that you would get it. There was variation over this, is that there was, I think, 3 distributors. There's 3 companies that sent out the boxes. McAllen, PepsiCo, those were the 2. And there's a 3rd one that I'm forgetting the name of it. The PepsiCo, they just sent Pepsi. I'm just joking. They sent a lot of other things in their boxes. But at any rate, is that for these is, and then they were shipped by either UPS or United States Postal Service. So people had no control. There was variation between who sent you the stuff, whether McAllen or PepsiCo, what you would get in the box. There was definitely variation over that, and some variation about where you lived. But the only group that got to choose to do something differently is for households with children with allergies. They could choose a separate type of box. They couldn't choose what was in the box, but if they said, we're allergic to gluten or whatever, then there would be no gluten products in that box. But that was distributed.
Sorry, what determines which school districts get those meals?
Is that what determines it is just your location. So depending upon which location you are in, you will get food distributed. For example, I think McAllen probably covered most all of Texas because that's where their headquarters are. So in other words, within the same school district, everybody would get this food from the same place.
All right, any additional questions?
I just wanted to push back on the RCT comment really fast.
Really?
Well, what we've been trying to do now, because I do think what you raised is an issue, is, we have an RCT where we have some kind of intervention and we don't offer it to the control, and then we offer it to the control. So they're still getting it, they're just getting it a little later.
Yeah, right. The problem the problem I had with that is if you think the program is successful, then what? Then just give it to them now. If you think, but if the program's unsuccessful, why are you going to give it to them? I mean, I guess that's my issue is if you already think it's successful, you get it later. So it's like, well, you found that it's not successful. I don't want this. I don't know how that works. So, but this is, yeah. So no, I don't know. I mean, it seems like it'd be fair, you know, when people go in for a trial, like placebo versus non-placebo, when it's done, because you really don't know if it's going to work. I know, like with placebo trials, I mean, with the medical trials, if it is becoming apparent that a drug does work, is that people will all get it. I mean, it's unethical to withhold a working drug from people just because you want to complete the trial. And I would actually say something similar holds in this case, but I know it's a common thing to do. So.
I also just want to say I love it because so Craig's been in these like FAR group discussions, and so we've had some really interesting conversations. If you want to get him started on something, you can ask what his opinion is on nutrition security.
Yeah. Oh yeah, that's just an awful term. Yeah, but anyway, we could talk about that later.
Okay. Any final questions for Craig? All right, if not, we're going to see if I can play a video. Hopefully this will work. Good afternoon, everybody. The title of our presentation today is Using Truck-to-Trunk Programs to Increase Food Security and Help Support Farm Income. And it's probably helpful to know that this is basically a case study of Georgia's truck-to-trunk program during the pandemic. My two co-authors and I are going to take turns presenting. I'm a professor at the University of Georgia, and Jared and Julia are both PhD students there. You can hire Julie this upcoming cycle, and you can hire Jared next year. Both should be on your radar. Next slide, please. Here's an outline of the talk. We got involved in this paper because it combines all our interests. Julie is studying farm production and how farmers manage risk. Jared is interested in food insecurity. And I am currently on loan to the governor's office, working as a state economist, and was involved in creating the program in Georgia. Next slide.
I'll start off with this first important topic. So, in the spring of 2020, when the pandemic first started, the U.S. and state and local government actually immediately ordered restaurants, bars, and schools to close. And specifically the restaurant industry, this
Hey, Dr. Dorfman.
closed for even.
It's really quiet. You can't hear Jared at all.
Is the sound being shared through the computer or through a mic?
Through the computer, I thought.
I believe it's, yeah.
I'm sorry, I have the sound up to 100.
This is what we get for trying to outsmart the technology.
So, I mean, do people, if you crank up your speakers, can you hear?
I'm at 100 on my end.
All right, I'm going to optimize for video clip. Let's see if this helps.
Restaurants that noted temporary close until the crisis was over, or in more worse cases, going out of business because they just couldn't keep up with it. and there was just no clear knowledge on whether like the order was going to uplift. So they just closed down. Next slide.
So with these restaurants and schools closing, a lot of farmers who provide products for that segment of the food industry suddenly found all of their demand for their particular product either greatly reduced or gone. And this left a lot of farmers sort of stuck with produce and product that they'd invested in already that had nowhere to go. So that this led to a lot of pictures like these, where a lot of crop farmers ended up having to plow under their product for the year. So the picture on your left is a lot of onions that are just sitting on the ground getting ready to be buried. And then the picture on your right is green beans that should have been picked and gone to restaurants or wherever their demand was needed that will now be plowed back into the field that they were grown in. So this really hurt a lot of farmers. And then you'll see in this video, so that was an entire tank of milk that was just being let off into the ground because there was nowhere for it to go. Since the demand for different food goods in the grocery and like at-home cooks is very different from the restaurant and the school industry. So restaurants tend to ask for larger amounts of items like in bulk and much less processed things. So raw vegetables, larger cuts of meat than cooks at home do. So you'd think that the demand would be offset by people now cooking at home versus in restaurants or at schools, but it wasn't. So long story short, the farmers had a lot of product that had nowhere to go.
These photos are just some visual content to show how the demand for food assistance rose by a tremendous amount during the pandemic. You can see both lines of cars for food giveaways and people standing in line at a local food bank. In the Atlanta metro area, for example, the food banks reported that the increase in food distributed was 70% in the early stages of the pandemic. Next slide, please. So in discussions with the governor's office and the Georgia Department of Agriculture, we wanted to find a way to help farmers and families facing food insecurity. A truck-to-trunk program seemed like the best way to go. This would allow us to buy produce and perishable commodities from producers in bulk and then reorganize them into mixed product boxes for either sale or giveaway to consumers that either needed some healthy food or were facing food insecurity and needed food, period. We were looking at using CARES Act funding to do this, and we're sort of figuring the details of that out when USDA began their food box program and provided funding for states to use to issue contracts for private companies to do basically exactly what we were already planning to do anyway. So Georgia merged the two programs and moved forward.
So we had two models of this program that were the same goal of connecting farmers and families, but sort of approach it slightly different ways. Our Cobb County model was run a lot by the Department of Agriculture, where they contacted farmers who grew enough, a large enough quantity of products and a large enough variety of products and could transport these to the distribution site. And then once the trucks with the produce or whatever product that they were bringing got to the distribution site, these boxes were then sort of mixed up into a variety of products instead of one giant box of peppers or squash or something, so that consumers could get a mixed box. And this was done by volunteers or by workers that were borrowed from the logistics company that helped with a lot of the organizing and the logistics of the distribution. In the Cobb County model, boxes were either paid for in advance via the online portal or on site. And then at the end of the day, the boxes that were left over were donated to the food bank. Similarly, the DeKalb model also used a logistics company. They both groups of people stressed that like having that logistics company was very helpful to them, especially if you're in a high traffic area. and keeping traffic flow going, especially if you're like the Cobb model and doing transactions on site. The DeKalb model actually did not do transactions. They just gave those boxes away, mostly funded by the CARES Act money that the county had. And this model is also a bit more streamlined as they worked with a food distributor who sold them already mixed boxes. So there was no repackaging of boxes on site and there were no transactions on site, so it was very quick. And this distributor worked with farmers who were selling to the restaurant industry originally, but had lost that demand. So if you're looking for a more streamlined model, the DeKalb model is probably where you're going. But if you have less funding to buy these boxes ahead of time, probably the Cobb model is your best bet.
Okay. So I actually had the opportunity to actually go to one of the DeKalb food giveaways. These are pictures that I took while I was at the event. So the white boxes are actually about 20 pounds of fruit and vegetables that were given to people. And on the side, the little brown boxes are 3 pounds of meats that was from their meat distributor, Joe Samples International Food. And they had included Salisbury steak, meatloaf, and country fried steak as the different meats for that day. Next slide. So this picture showcases how the cars were set up and just the distribution route. So the event started roughly around 9. I didn't get there till probably 8, and there was already cars lined up getting their food boxes. The cones denote the area where they had to drive up, and in the foreground or behind the camera is there's police officers and firefighter recruits that were putting the food boxes into people's cars. They also had overflow parking that was on the other side of the stadium, which is in the foreground. And on this specific day, they needed it because there was a lot more people there. And that white tent that's on the far left side, right here, yeah, circling right there, that's for people that did not have vehicles, where they could residents that could come up and get those boxes and then just take them home and walk away. Next slide. Because of the COVID pandemic, one thing that they also included was a COVID care kit, which included masks and hand sanitizers.
So we learned several things from having to sort of put these programs together on the fly because it was in the middle of a pandemic. But if we need to do them in the future for various other reasons, having a list of farmers and transportation, if that's a limiting factor to farmers participating in the program, processing and logistics contracts, like knowing who those people are ahead of time and how to get in contact with them is super useful and helps streamline a lot of the process. You're not having to call around and figure out who's available to do what jobs. It also helps in your local community to pay farmers for the commodities that they currently have in surplus around you. So that also limits your transportation costs. So you're not trucking produce from all over the country into where you are. You're really using those resources in your local area, and that really helps both your local farmers and to lower the cost for the program.
And for pay logistics, such as how Julie mentioned earlier, like hiring a contractor to buy commodities from producers and repackage them into mixed food boxes, and pretty much also just paying attention to the speed of the consumer distribution sites. And again, speaking of distribution, whether it should be free or paid, it should really match the local economic conditions. For example, if a location if their problem is primarily disruption in the supply chain, then doing online payments can work for both their distributor or their consumers and for the farmers. But if the site is facing a food security problem, which is worse than the supply chain disruption problem, then you need sufficient funding in order to better make those boxes free so that you can give them away.
All right, now we have a little video to actually show you one of our distribution days. This one would be under what we call the Cobb model, where we are selling boxes online in advance and on site and then giving away the boxes at the end of the day to local food banks.
When you want to do something right, you come to Cobb County, that's for sure. And Sheriff Warren and Mayor Tumlin, the whole Chairman Boyce, the chamber, y'all really stepped up. We're grateful.
Okay, I'm gonna have you pull up as everybody else pulls up, please. We'll get you loaded.
Let's get the farmer's basket with cabbage and a box of milk. And I got both baskets.
We birthed this idea several weeks ago when Mayor Tumlin and I were just on the phone, and we said, well, let's get the Cobb family together and see what we can do. Because I know you're always going to do it right.
I think this is a good opportunity to support the local farmers and to get some good produce for a cheap price. I cried when I saw that squash being run over by a John Deere.
I think that we've all heard the stories about our farmers around the country who've had to throw away crops.
Who's going to squash?
And nobody likes that story. I think that what we are seeing is Cobb County embrace this opportunity to help support Georgia farmers and get some delicious food in the process.
And what happened was when we had the immediate shut off of food service and school nutrition, then that happened right in the middle of Florida season. So we saw some of that tragedy take place south of us. We're fortunate that we had 3 to 4 weeks to kind of notice that and try to pivot in a way that would be helpful. And hence, we birthed Georgia Grown to Go.
I think it's wonderful that everyone's coming out to support our local farmers, get the fresh produce. We've had a lot of people donate to our nonprofits. It's just a great event. And as we were talking, this is the first traffic jam we've had in Cobb County in the last 10 weeks.
They do need it now more than ever, but I'd suggest that we all need one another now more than ever as coming through this challenge. It's going to bring us closer together, and I think we're going to understand that our food system is a pretty important part of national security.
Food box programs or truck-to-trunk programs clearly have a place in the farm policy food assistance universe. And given the likelihood that they will happen again, we should know how to do them well. The key lessons we see emerging from this essentially large-scale trial are that local political support is important. That means you want to be buying from local farmers, preferably commodities that are in surplus at that time so the prices are low, and buying those really help the farmers more than buying things they could sell anyway. Having logistics capacity available is key. So I think it really makes sense to make sure there's adequate funding to be able to hire professionals to purchase the single commodity in bulk and then repackage into the mixed boxes, as well as handling the transportation and setting up the giveaway sites. Networks and connections are vital. You have to have names in advance, have people lined up if you're going to be able to respond to supply disruptions that tend to happen quickly and may not last for very long. And finally, it helps if you pay pretty much everybody involved. So you need to pay the farmers, not expect them to donate the food. You need to pay the logistics and distribution companies for the work that they're doing as well. Right? Those are the lessons that we saw both in Georgia and from other states that did food box programs at the same time. And we hope that this case study helps people to be more efficient and successful when we do food boxes in the program. Thank you very much for listening, and we're happy at this time to take any questions. All right. Sorry about the volume at the start. We tried to pre-record so we would avoid such technical difficulties, but just had to click the right button. So if it wasn't clear at the start, in my current job as state economist, I was sort of in the eye of this storm, and when the lockdowns just started to happen, as you heard the Commissioner of Agriculture say in the video there, Florida was harvesting their vegetables and ours were in the field and growing. So we had a couple of weeks, and between staff in the governor's office, the Commissioner of Agriculture and his people and myself, we basically put a food box program together on the fly in a couple of weeks. And then just as that was rolling out, USDA came out with their funding for the food box programs. So we said, well, we know how we can pay for it all now, which made it much more popular, right? We had the whole program designed we didn't necessarily have tons of buy-in to get money from the governor yet, but the governor was perfectly happy to have us go after the USDA money. And because we'd already put the thing together, we were kind of ready to bid on that pretty quick. So I think there's some interesting parallels here among all three of the papers, in that we're seeing different responses in quick periods of time, and trying to figure out both what works and how it works. The first two papers are a little more of what works, and our paper is a little more how does it work, right? It's easy to gloss over this stuff, but if you think about it, if you spend even 10 seconds giving a person a food box, you won't be able to feed many people in a day. The logistics involved are amazing. You really need to be pumping out a box every couple of seconds.
Yeah. I think I did the math at one point, and like spending a minute doing a transaction and giving someone a box for the Cobb model, they wanted to get out like 15,000 or something. It ended up equaling like 10 days. So you have to be very fast.
Yeah. All right, any other questions before we get President-elect Norbert Wilson to do our discussion?
So one thing that I could ask, and we might come back to this after Norbert's comments, but just regarding specifically Jeff, Julian, and Jared, your paper, I was really interested in the video clip, and the Agriculture Commissioner and so forth, and especially also the people, in these, receiving these programs. And just wanted to ask about kind of the gift exchange aspect of it and civic pride, and the idea that you have capability when, you've demonstrated this response. It's like having an effective fire department or something, where you, on the one hand, build civic pride and the capability of the community to respond, but also break down some of the stigma. So my impression would be that people were willing to go into vehicle lines for delivery who would not appear at church basements or food pantries. I'm just really curious if you have any impressions about the civic pride on the one hand and the willingness to receive on the other, both sides.
I think you're right. So there is some civic pride, although it's worth noting that the site you saw in the video, as well as the site you saw in the photos where Jared visited, are both in the city of Atlanta. So the food is all coming from farmers that are 3 hours away, right? Georgia's a big state, but it is still in Georgia. They did brand it as Georgia grown to go. So I think there is definitely an implied idea on our part, designing this program, that people would support it more knowing it was going to help Georgia farmers. And that these people could have just driven to their local supermarket and bought some fruits and vegetables. And they're purposely doing this to try and avoid food waste in the field and help the farmers out. So I think that is a thing. There may also have been some willingness of people to do this. Now, the video one in Cobb County, people were buying the boxes. Yeah. The one that Jared visited, the boxes were being given away. So there it might be easier to show up, act like you're supporting the farmers in the community, but really what you need is just some free food. And this is a way to get it without admitting that you need the free food.
Yeah, I agree. It touched on, especially speaking from the DeKalb event, interviewing people such as the police department who had the recruits out there giving people boxes. They viewed it as not only a good way of giving back to the community, but also showing that the police here are here for you and help you, and also give the recruits a chance to understand the residents. Like as they were coming in, just, still socially distanced, but like talking to the residents, how many boxes you need and whatnot. But also on the supply end, it also provided a chance to support Georgia-grown businesses. And hopefully, okay, when the pandemic's over, the idea would be, oh, well, I got this food from a Georgia-grown place. I want this to be in my grocery store, and that creates demand for it. So it just touches on all things that kind of like push the narrative forward.
Yeah, and I think that like having the payment mechanism, like if it is one of the programs that does pay, it's almost like a drive-through farmers market. So you get kind of that aspect of people who like think it's cool regardless, because they would go to a farmer's market and talk to the farmers there, but here you're just getting it in a box. But yeah, so that like payment aspect can edge into that a little bit, but yeah, it's a good question though.
There's an interesting thought that people see it like a farmer's market when actually it was bought from the same large farms that the supermarkets buy from.
Yeah.
It was processed by the same processors that process for the supermarket, and it was driven in the same sort of trucks by the same trucking company. So I mean, it's really all we did was cut out the supermarket. Other than that's the same, but it probably does pick up the cachet of a farmer's market. And I'll bet you there'd even be people who tell you that it's healthier, it's fresher, and you know, probably more nutritious.
Food marketing's a thing, man.
I'll just say as a comment, you know, one thing that I was surprised about during, especially early on in the pandemic, was how little the powers that be at both the state and federal level knew about supply chain logistics. So as an example, and I was just thinking about, you know, your comments and, you know, in the presentation about really kind of knowing some of these pieces and having them set up before you start to do this program. I was contacted pretty early on by the Department of Defense and Department of Homeland Security because I maintain this sort of mapping tool for the state where we try to identify where different types of infrastructure are to help connect different pieces of the supply chain. And, you know, all of a sudden, I think they had been alerted to the fact that like they had to understand better where there were some of these pinch points around food processing in particular. I thought that was pretty interesting, right? They're coming to this like local food systems map essentially to get information because they don't have it, right? So I thought that was a big eye opener for me.
I mean, Becca, you're exactly right. I think a lot of people in government learned a lot about logistics that they'd never thought about before. You probably shouldn't, any of you, repeat this in public particularly, but I can tell you that Georgia's emergency management agency and sort of state defense apparatus that had to help set up sort of mobile hospitals and distribute COVID vaccines and supplies, we didn't have warehouses. We had, if the feds wanted to send us a whole bunch of, you know, PPE, we had to go out and get warehouses so we had a place to put it until we could distribute it. You would think we would have had some warehouses laying around for stuff like that, but apparently no. In past emergencies, you just got aid and passed it out as a continuous flow. You never had to warehouse it first. So now we're in much better shape logistic-wise than we were.
I have a follow-up of Dr. Dorfman's comment about, you know, supermarkets and the truck to program. They seem to get for the food from the same farms and same trucks and processing companies. So why wouldn't supermarkets also, you know, advertise they are sourcing from the local farmers and they are helping reducing the food waste just to help boost them?
Sure.
Have they done anything about that?
So they do. So supermarkets in Georgia can stick Georgia grown stickers on things or have Georgia grown signs. So we do have sort of a branding campaign. But the supermarkets sort of, you know, have their contracts in advance and have their rules and regulations you got to follow. If you want to sell to Walmart, you got to do a set of things. And the supermarkets weren't ready to ramp up and say, okay, if nobody's eating meals out, we should order twice as much fruits and vegetables, because they weren't sure that we were going to buy them. One of the things that a lot of people learned at the lockdown phase of the pandemic was that apparently most Americans only eat vegetables when they eat in a restaurant. And even then, I'm not sure they eat them, but at least they get put in front of them at the table on a plate. Yep. That there's a huge segment of the produce industry in the United States that all goes to food service, that nobody buys it for home consumption, or very, very little gets bought for home consumption. And I think the supermarkets weren't willing to sort of double, triple, or multiply by 10 the orders they normally put in for broccoli or bell peppers on the assumption that because we're not eating out, we're going to order more bell peppers. But I think
like,
that was it, just too much uncertainty.
Or like things that we don't eat at home. Like, I don't really know that many people who put like, I don't know, microgreens or like other fancy stuff that like ends up on a restaurant menu that you don't like cook at home, because most of us don't know how to cook super fancy vegetables.
Important to note though, Park Wild does in fact use all those things like microgreens at home when he's cooking.
Fair, fair. Not all, I said not all of us, but
yes.
Some of us might.
I think I've got a different impression of the relative fraction of restaurant food and grocery food that goes to fruits and vegetables. I think grocery food is the source of a higher fraction comparatively of fruits and vegetables, and restaurant food a lower fraction of fruits and vegetables. So the last round of comments was surprising to me.
Park, the difference is between, you got to separate the fruits and vegetables. So for fruits, you're right. But for vegetables, not so much.
Yeah. So,
and in particular, the vegetables grown in Georgia and the Southeast, like Florida as well, the vegetables we buy for at home are basically some leafy greens, you know, like spinach or lettuce, right? Broccoli, carrots, maybe bell peppers. Not a lot else, right? There's, you know, the whole sunchoke industry was kind of out of their buyers. Nobody was buying ramps at the grocery store. So there's a lot. We all buy fruit, and I don't usually get fruit in a restaurant. But this even surprised me that how much of vegetable production really went. Now, and not just restaurants. We're including food service. So school cafeterias buy up a ton of vegetables, right? Because they have regulations from the government, so they've got to put those on the plate. When the school lunch programs shut down, that was a huge source of demand for vegetables gone.
Yeah.
It also seems like it is highly specialized by region. I mean, I could tell you in Colorado, over 50% of our fruits and vegetables are potatoes, and our potatoes are almost all for the fresh industry, the fresh market, the retail sector. And so we actually had a spike, right? And because prices went up, and it actually helped our growers, you know, as opposed to the Idaho potato growers that are, you know, mostly for processed. So I do think it's also that we just have within regions, we have such specialization around the supply chain.
Yeah, I agree with that.
Okay. Are we ready to hear from President-elect Norbert Wilson?
Hi, everyone. And thank you all for the papers that you've presented. And I will say, I'm also going to make sure I don't talk too long. I congratulate you on getting this work done. As we've all been going through a pandemic, it's difficult and it's been a trying time. And I would say the other side of this is the work that you all are doing reflects the need for quick responses to immediate changes that happen in our society. I think it's too easy for us to have studies that we plan out in advance. And obviously that's a better way in many instances, but we do need to make that space for how do we do analysis of projects or problems that arise? How do we address them quickly so that we can actually learn from them, maybe not in the moment, but as close to the moment as possible. So all three of you have done work, or all three of those papers were doing work in that way that I think is really appreciative, that I'm appreciative of. The other side of that is the three papers also reflect the difference of what we can do in our profession in terms of the kinds of analysis. So the survey work, something like an RCT, and Craig, I know you're not a fan of those, but it is similar to an RCT, and also the case study approach. I mean, that's the great thing that of what we saw today was this ability to use different methods to help us get at a problem. And so I'm appreciative, again, of that also. And it does, the different approaches also reflect that need to move quickly when there is a challenge. you couldn't go through, you know, a pre-analysis plan necessarily, or go through certain steps to actually get this work done, because otherwise you would have missed the opportunity. So for all those reasons, I think developing even ways of how do we respond to an emergency, or how do we respond to a major shift as a profession, I think is a useful thing for us to think about as we move forward. I pray to God that we never go through another pandemic, and so that hopefully we never need to know how to do this. But I can imagine instances where a natural disaster occurs, we need to move quickly, and analysis that can be helpful is, and that this one actually is, I agree. We need to find ways of doing that in a way that we all agree is appropriate and correct and moves us in the right way forward. So that was great to see. I'll talk about each paper for just a moment, and then I'll just give some concluding comments. So Becca, was really great to see your presentation. And I know the challenge of working with community partners and getting a survey out, and the fact that you were able to get so many respondents so quickly either reflects just the challenge of the current moment, the deep connections that you or your community partners had, and the fact that people could use the $20. And that's not a joke or dismissive. It's just, it reflects, I think, a number of things. The one thing I would also encourage you to think about or look at in the data is, I was a part of a survey effort once where we were using Qualtrics, and we sent it out to community partners. And one of the things that we discovered was that people were able to do the survey again, or they had multiple people in a household do it. So I just encourage you to look at the data, see what's there. Hopefully there's not a problem, but I just encourage thinking about that and looking at the data quality in that respect. I think Jeff offered a really useful way of thinking about how the COLE responses that either went through too quickly or other ways, and that's just something just to acknowledge. One thing I wasn't clear on, and you realize I didn't ask any questions throughout because I was holding them back for this. One of the things I wasn't clear on was why just look at the city of Denver, and that may have been there and I just missed it, but I would be intrigued to know, since you had all these other folks who were outside of Denver, especially if they were in the surrounding areas, there could be something important, unless those programs were only for the Denver city population. And so I would encourage thinking about that. Maybe there's something beneficial in that and those other folks. The other thing that struck me in the analysis that you showed is the fact that some of these programs overlap. So you could have a food pantry that happened in a church that was a charity, and it wasn't clear to me how a person would know if it was one versus the other, if they counted as both. And it was just thinking about those fuzzy lines of where one program existed as opposed to another. And so thinking about that a little bit more would be useful. I think it also is interesting to note, I've been dealing with this with some graduate students at Tufts, and this idea of dealing with race and identifying how people identify as race, by race in terms of who's the head of the household versus what the household looks like. And thinking about that a little bit may be helpful for defining some of the work that you're doing. But overall, I think there's something fascinating in the work that you all are presenting, thinking about what it means for children. And I'd be intrigued to see what ends up happening when you look at some of the statistics on food security and the role these different programs play. There was a paper actually at the AAEA where folks were looking at how people use multiple programs to address their food needs, and there may be something interesting there in the data that you collected. So overall, really happy to see this work go forward, and just, I know there's a lot more work that's coming out of this. It looks like you have plenty to do with the data that you have. So very good. I want to now go to Craig's piece. And Craig, I appreciate the work that you're doing. We'll call it a trial and won't call it a clinical, an RCT, but it's obviously really important work. Being able to see what the effect of that food distribution is important. I will say it was helpful to hear you give the description, and now I understand, and I'm gonna ask it as a question as opposed to saying what I think it was. It sounds like what you were doing, as you said, was a more like a dose response. So some people at the time of the survey may have received 1 box or two boxes or whatever. And that would have been helpful to understand a little bit more clearly what that distribution looks like, because that's actually really fascinating to understand that, you know, what is the effect of just an additional box? And I know you did it as 10 boxes, but I realized that people were at different places. So just thinking about how that is communicated would be helpful. Also, the context really matters. I would say, I almost wonder what it would look like if you had just looked at Texas and Louisiana. I wonder if there's something different about those 2 locations because they were the major place where where the programs existed, and if they somehow look a little different than the larger part of the sample. But that's not a criticism, it's just more of a question. And this was already raised, it was the cost effectiveness of these boxes and thinking about what does it mean for each box, and just saying what is the cost and what does it mean for the benefit of the reduced food insecurity. And I'm gonna say that in terms that I don't agree with, but I can imagine that there could be folks who would say, well, what does it mean to have a reduction of food insecurity by 1%? Is that really enough given the cost there? I'm of the mindset if we can reduce food insecurity by 1%, I'm in favor of it. But I do believe there's a cost benefit analysis that could be helpful. You've suggested that would be a part of the work. I know it sometimes feels crude to talk about it in those terms, and I'm not a fan of talking about it in those terms, but I think there is something about what is the real benefit that we gain out of that expenditure in terms of reduction in the food insecurity rate. But obviously working with the folks that you're working with, this is an important study to see go forward, and I can't wait to see the final version of what that ultimately is. I want to quickly go to the case study by the folks at UGA, and it's really good to see this work go forward. In terms of case studies, I think you hit on some really important points. One of the things I'm really grateful to see is this idea of trying to understand the implementation of a particular program. And that was well done, and I encourage you all to think about actually going back and doing some work in terms of talking to some of the people who were involved in it. I saw that was in the write-up, and I encourage a little bit more, because I would have liked to have understood a little bit more of how farmers actually understood what was the benefit and how they gained from this. And on the other side, even thinking about talking to some of the logistics firms in a little bit more detail to get what it took to get that project forward. Given that I'm from Georgia, I knew the difference between Cobb and DeKalb, and those are very different community or different counties, and the people who participate in those programs may be very different. One was for a price and one was free. And so just thinking about the context could be really useful to explain the difference between those programs. I would love to see that show up in this. I will note that Gary Black, I know, is going to run for the Republican nomination for U.S. Senate. And so I felt like I know that there's some interest in seeing his face, not that you all were doing that, but I know that there's this real interest of showing connection. And so thinking about why was that place, why was Cobb County considered the best place compared to, say, other counties in the state, especially given the difference in poverty in different parts of Atlanta. So for all those reasons, I think there's something really good about what you all have done. I just encourage thinking about digging in a little bit more with some of the stakeholders to get their part of the story, and encourage that qualitative research component out. I think you have a lot there, and it would be helpful to push that a little bit further. I'm at time. I didn't want to go over too much more over 10 minutes, so I'll just stop there and say I'm really grateful to see the diversity of work that you all are doing. I encourage the full development of these papers, and they provide us a great foundation for future work on how to quickly respond to an emergency as it relates to the food system. And I thank you all for the work during a really challenging time.
Thank you, Norbert. Great session. I will say on the Gary Black thing, the video is actually from before the Senate special election. So he probably wasn't thinking of running for the Senate at that time, since he would have assumed that there wouldn't be an open seat. But he is definitely running now, which makes things very different. And if I can just we still have some time if people want to use it to go back to more questions. I wanted to build on something Norbert said there for Craig. Craig, I think Norbert's right. So the way you did the impact with the 10 meals thing sort of implies that the response is linear. And I think what Norbert was pointing out, and I would agree with him, is that there's a good chance it's nonlinear, that getting 2 boxes may have much more than twice the reduction in food insecurity that 1 box did. And 3 boxes may do way more good than, you know, triple 1 box. So you might want to play around with some nonlinear responses.
Okay, you may have, okay, have a squared term or something. Okay, great. Oh, that's, yeah, okay, good. That's good to know. One, if I could also respond to one of Norbert's things. Yeah, so I really like this discussion about how much will we be willing to pay to reduce food insecurity? Because there's really, I mean, for my, you know, there's definitely healthcare costs associated with food insecurity, but the main argument against for reducing food insecurity is that it's just the right thing to do. There's nothing in and of itself that's wrong about having food insecurity. And so I have this paper that came out recently in food policy, which the cost per, I make the argument, basically set up staff as a UBI type program. And one of those specifications is the cost to per food insecure person to eliminate it is about $20,000, which is far more than they're getting in the SNAP benefits that would be. So it's I don't know what the right number is, and 20,000 is, you know, that would be almost, you know, complete reduction in food insecurity. So this is 1%. So I don't know how much people are willing to pay for these reductions. Let's put it this way. I think that 1% reduction that we found in ours is probably pretty expensive. It's a pretty expensive 1% reduction, probably far exceeding the cost of the program in terms of it. So, but yeah, no, I think that's the next step in terms of a lot of food insecurity research, how much we're willing to pay. I don't even know how to define that. I mean, I hate to ask people, like, food secure. Well, how much would you pay to have people not be food insecure like they do environmental things? I don't know how that could be framed, but I think it's important.
Well, you'd never get a straight response.
Right. No, exactly. So.
Well, I think the other piece that's really interesting about that question is that, you know, there's some cost to dramatically reduce food insecurity, right? And then there's sort of that tail. And that tail is going to be the really, really expensive piece. I mean, just from talking to our partners in Denver, you know, that now they're putting all of this energy and money, financial and human capital resources into like that last piece, those people who've been underserved and left out. I think those are the numbers that are challenging, but I think really are an ethical question.
Yeah, no, I completely agree with that. Yeah, that it's really, there are a lot of tough cases that just giving more money and some other things may not really solve the problem. I think it's difficult.
I just want to say one nice thing about being a bit of a tourist in this, coming from, you know, the international side and thinking about assistance in food insecurity measurement in, you know, mainly in Africa, but also South Asia, is the way these 3 papers kind of touch on the different dimensions of food insecurity and emergency response, where on the one hand, food insecurity is the one aspect of the food system that's sort of always with us, right? So even college students in Denmark, from affluent families, they would sometimes be food insecure, right? So because it's not actually a metric of the food system, it's a metric of financial insecurity, right? So food expenditure is regular as TikTok, right? Food expenditure is one thing that you know is going to come every week. And so food insecurity is really a metric of financial insecurity because it's the one expenditure that's so recurring. If you're not able to meet it, then that's because you have other things you need to do, right? And you are exposed to healthcare expenditure shocks and other expenditure shocks. So one of the interesting things is how these are distinguishing between just responding to the financial shock versus something specific about the food system. And whether that's, you know, and whatever it is, it's about finding the moment when you can harness civic energy finding the one moment when people can come together, finding the one organizing principle that can overcome mistrust or resistance or stigma or whatever, and get people to actually fill a gap. So I really admire, you know, the creativity and the insight that says, oh, here's a moment where the Georgia harvest is later. That means we can get money, you know, and maybe state appropriations wouldn't have come forward, but maybe they would have, and been able to fill a gap, you know, with high marginal utility, even though it would be, you know, because there was a gap left by purchasing power or by logistics, you know, and because you know for sure that Walmart can, whatever it is, Walmart can do it cheaper than you. That's always true because they have experience, and doing something for the first time is always, like the first pancake's always not so great. So you're always beginning from the point of view that Walmart can do it better. And so you're always responding to shocks, right? Or some kind of public goods or services. And these 3 papers give like a really interesting insight into the nature of those different ones. Those different niches that can be filled by the public sector or the charitable sector, as opposed to Walmart, you know, which will always do it cheaper.
Right.
But only if it's predictable and profitable.
I think that's an excellent insight. And one of the things that we're trying to see if we can follow through with in Georgia is if we can essentially have a ready to go food hub sort of on ice, you know, processing facility, so that when disruptions like this hit, if the state would have funded something like that, then at that time we can flip the switch, we can buy whatever there is surplus of, then run it through there, get it in these mixed boxes, get it out the door easily. It wouldn't cost that much. I mean, you know, packing sheds are not high-tech operations. And it could even be as simple as, you know, the funny thing about packing sheds is they're not in use most of the time, right? You know, peach packing sheds are used when peaches are being harvested, and onion packing sheds are used when onions are being harvested. And not everything we grow in Georgia is harvested at the same time. So you can probably build an inventory of things that would be available for use whenever you need them. And you just need that list and those people to have signed up, kind of like the ready reserves. You know, when we need to move troops, we have ships and planes that the military can just say, hey, you belong to us now. So if we could have a list of packing sheds that aren't busy in June, then when there's a disruption in June, that's where we would go do the work. And it might be a different set of places in September. But we've learned the value of putting this infrastructure and having the knowledge and the network connections in advance, ready to go, so that you can respond quickly.
We could, you know, even possibly launch some of the warehouses to the emergency management system if they need to.
Okay, well, we lost Craig. He ran out of time, but we can continue. We can talk about him more freely now, or we can talk about Becca's paper more, or our paper more, or we can wrap this up. I am your benevolent host, happy to do whatever people wish.
While he's out of the call, I just wonder how we can do the study of his impact on Baylor, because clearly there's some big shock happening there. There's going to be some interesting tests of the Craig Gundersen effect on arrival in Waco, Texas.
Yes, and
we'll call it an RCT.
The good news is, because Scott Cunningham is there, right? we can make sure it's causal.
There you go.